Right now, as you're sitting here watching this, something is happening inside your arteries. And if you're over 60, there's roughly a 75% chance it's already there. Plaque. Building up, layer after layer, year after year. No pain, no warning, nothing. Until one day, something breaks loose. And that's when everything changes. Fast. Heart disease kills over 680,000 Americans every single year. That's one person every 34 seconds. And 82% of those deaths? People over 65. Now here's why I'm telling you this. Because a specific type of fish oil, not the stuff most people buy, not the generic capsules sitting in your cabinet, a very specific form, has been shown in clinical trials to do something doctors didn't think was possible 10 years ago. It can actually help support arterial health and stabilize plaque. But here's the catch that nobody talks about. The way most people use fish oil, it does almost nothing, and I mean that literally. One of the biggest cardiovascular trials ever conducted tested regular fish oil and found zero benefit. None. Meanwhile, a different trial using a different form found a 25% reduction in heart attacks, strokes, and cardiovascular death. Same name on the bottle. Completely different results. And if you don't understand why, you could spend years taking something that isn't doing what you think it's doing. So let me show you exactly what the research actually says, which type to buy, how to take it, and the one mistake that turns a potentially life-changing supplement into expensive nothing. Stay with me, because what comes next could genuinely change how you think about your heart. Okay, let's talk about apply fish oil here, because I know that's why you clicked, and I'm not going to waste your time. Here's the truth, and I want to be upfront about this. The idea of rubbing fish oil on your wrists or your chest or your neck to clean your arteries, there's no science behind it. I looked. I searched every medical database I could find. Not a single clinical trial, not one study showing that putting fish oil on your skin delivers enough omega-3 to your bloodstream to make any cardiovascular difference. Your skin just doesn't absorb it that way, not in the amounts that matter. But here's where it gets interesting. The place you do apply fish oil, the here that actually works, is your gut. Oral. You take it by mouth with food, and when you do that correctly, with the right form, at the right dose, something remarkable starts happening inside your arterial walls. Something we can now see on imaging. And I'm going to show you exactly what that looks like. But first, you need to understand why most fish oil fails. Because this is the part that surprised me most when I first dug into the research. There are two main omega-3 fatty acids in fish oil, EPA and DHA. Most capsules contain both. Seems logical, right? More is better? That's what I assumed. Turns out, that assumption might be the single biggest reason most people don't get results. In 2019, the New England Journal of Medicine published a trial called Reduce It. Over 8,000 patients, all on statins already, all with elevated triglycerides. They gave half of them 4 grams a day of pure EPA, not EPA plus DHA, just EPA, the highly purified form called icosapent ethyl. After nearly 5 years, the EPA group saw a 25% reduction in cardiovascular events. Heart attacks dropped 31%, strokes dropped 28%. Cardiovascular death dropped 20%. These are massive numbers. Numbers that rival some prescription drugs. Now, here's the part that makes your head spin. A different trial called Strength tested 4 grams of mixed EPA plus DHA. Similar patients, similar design. And the result? Absolutely nothing. Zero benefit. They actually stopped the trial early because it was clear the mixed version wasn't going to work. Same dose, same type of patient. One worked, one didn't. The difference? Pure EPA versus mixed. And honestly, when I first read that, I sat there for a minute just processing it. Because it means millions of people are taking fish oil capsules right now that contain a mix of EPA and DHA, thinking they're protecting their heart. And the biggest cardiovascular trial on that exact combination said it doesn't work. That's not me saying it. That's the data. Now let me show you what pure EPA actually does inside your arteries, because this is where it gets incredible. There's a trial called EVAPORATE. They took 80 patients with documented coronary plaque, confirmed on CT scans, gave half of them 4 grams of pure EPA daily. The other half got placebo. After 18 months, they scanned them again. In the placebo group, the dangerous type of plaque, the soft, lipid-rich kind that's most likely to rupture and cause a heart attack, that plaque increased by 109%, more than doubled, in 18 months. The EPA group, that same dangerous plaque decreased by 17%, and total plaque volume dropped 9%. They could see it shrinking on the scans. Actually shrinking. Now let me put that in perspective. There's an older study from the Lancet where researchers actually examined plaque removed during surgery from patients who had taken fish oil beforehand. The omega-3 had physically incorporated itself into the plaque tissue. It was literally inside the arterial walls. And those plaques were more stable, had thicker protective caps, and showed less inflammation. Your arteries are not just passively clogging like a drain. They're actively inflamed. And EPA gets in there and calms that inflammation from the inside. Okay, but let's get practical. Because you're probably wondering, what about blood pressure? What about those numbers my doctor keeps watching? A massive meta-analysis looking at over 70 randomized controlled trials found that 2 to 3 grams a day of omega-3 lowers blood pressure by about 2.5 points systolic and almost 2 points diastolic on average. Now, that might not sound like much, but in people who have untreated high blood pressure, the numbers were bigger. 4.5 points systolic, 3 points diastolic. The researchers actually compared that effect to increasing your exercise and cutting back on salt and alcohol. And omega-3 held its own. In some cases, it was more effective. The way it works is through something called nitric oxide. EPA helps your blood vessels produce more of it. Nitric oxide is what tells your arteries to relax and widen. One study measured an 18% increase in nitric oxide release from the cells lining blood vessels after EPA supplementation. That means better blood flow, less pressure, less strain on your heart with every single beat. And here's something most people never hear about. Your body does something with EPA and DHA that no anti-inflammatory drug can do. It creates specialized molecules called resolvins. These were discovered by a researcher at Harvard. And they don't just suppress inflammation. They actively resolve it. They signal your immune system to stop attacking the arterial walls, clear out the debris, and start repairing tissue. This is fundamentally different from taking an ibuprofen, which blocks pain signals but doesn't actually fix anything. And ibuprofen, by the way, increases cardiovascular risk with long-term use. EPA creates molecules that do the opposite. Before we go further, let's just get something out of the way. I'm sharing research with you, published, peer-reviewed research, but I'm not your doctor. And what works in a clinical trial involving thousands of people might not be right for your specific situation, especially if you're taking medications. So use this information to have a smarter conversation with your doctor. Ask better questions. That's the goal here. Now, triglycerides. This is the area where the evidence is honestly overwhelming. The American Heart Association published a science advisory confirming that 4 grams a day of prescription omega-3 reduces triglycerides by 20 to 30% when they're moderately elevated. In people with severely high levels over 500, the reduction can exceed 30%. One pivotal trial called Marine showed a 33% drop in patients with very high triglycerides. Another, Anchor, added a nearly 18% reduction in C-reactive protein on top of the triglyceride benefit. CRP is one of the main markers doctors use to measure inflammation in your body. Lower CRP means your arteries are under less attack. And I should mention something important here. Pure EPA supplements don't raise your LDL cholesterol. The mixed EPA-DHA versions, some of them can actually bump your LDL up. One more reason the form matters. All right, now I need to tell you about arterial stiffness, because this one is directly relevant if you're over 60. Your arteries stiffen with age. That's not opinion. That's just what happens. And stiff arteries are one of the strongest predictors of heart attack and stroke. Every 1 meter per second increase in a measurement called pulse wave velocity raises your cardiovascular death risk by 15%. Here's where it gets interesting for older adults specifically. A Penn State study tested 12 weeks of omega-3 supplementation in both young and older adults, and the omega-3 significantly reduced arterial stiffness in the older group but not in the younger one. The people who needed it most got the biggest benefit. An even longer study followed over 500 elderly men for 3 years. The control group's arteries kept getting stiffer, which is normal aging. But the omega-3 group, their arteries actually moved in the other direction. After 3 years, they were more flexible than when they started. 3 years, more flexible. Not just slower decline, actual improvement. Now, here's where I need to make you a little angry. Because the fish oil industry has a problem. A big one. Researchers tested every single encapsulated fish oil supplement available in New Zealand. All 32 of them. And 83% exceeded recommended oxidation limits. That means the oil was rancid, damaged. Not just less effective, but potentially harmful. Oxidized fish oil creates the exact type of free radicals you're trying to fight. And it gets worse. 69% of those products contained less EPA and DHA than what the label claimed. You're paying for something, and more than half the time, you're not getting what the bottle says. This isn't a New Zealand problem. Studies from Canada, South Africa, and the UAE found similar results. So how do you know if what you're taking is real? 3 things to look for. First, the form. You want triglyceride form or reesterified triglyceride form, not ethyl ester. The triglyceride form is absorbed up to 70% better. If the label doesn't specify the form, that's a red flag. Second, third-party testing. Look for IFOS 5-star certification. That's the gold standard. They test for potency, purity, and freshness across thousands of product batches. Third, do the freezer test. Put a capsule in your freezer overnight. If it turns completely cloudy and opaque, it's likely ethyl ester form. Triglyceride form stays relatively clear. Not perfect science, but a decent indicator. And honestly, if your fish oil makes you burp or gives you a fishy aftertaste, that's a sign of oxidation. Fresh, high-quality fish oil shouldn't do that. If it smells like a dock, something went wrong before it reached your cabinet. Okay, let's talk timing, because I know you want to know how long before something actually changes. Week 1 through 2? The omega-3 is incorporating into your cell membranes. You won't feel anything. Nothing measurable is happening on blood tests yet, but the foundation is being laid. Week 4 through 8. This is where triglyceride levels start moving. Your doctor would see it on a blood panel. Blood pressure shifts become measurable around this time too. Week 8 through 12, full triglyceride effect kicks in. CRP levels drop. The anti-inflammatory machinery is running. 3 to 6 months? This is where it gets exciting. Plaque stabilization. Arterial flexibility improving. The changes that show up on imaging. Your arteries didn't clog in a month. They won't clear in a month either. But the process starts earlier than most people expect. Now, who should be careful? If you take blood thinners like warfarin or Eliquis, talk to your doctor before starting. Fish oil does mildly affect platelet function. The clinical data shows it's generally safe, even with blood thinners, but your doctor needs to know. especially at doses above 2 grams. If you have a surgery coming up, some doctors still ask you to stop fish oil a week before, though newer research suggests this might be unnecessary. Check with your surgeon. And at high doses, above 3 grams a day, there's a small increased risk of atrial fibrillation. It's modest, but it's real. The FDA considers up to 3 grams from supplements as safe. Anything above that should be under medical supervision. Here's what I want you to take away from this. Your arteries are not a lost cause. I know it can feel that way after 60, like the damage is done and you're just managing the decline. But the imaging studies tell a different story. Plaque can stabilize, arterial walls can become more flexible, inflammation can drop measurably. It requires the right form. Pure EPA, high quality, verified for freshness. It requires consistency, every day with a meal that contains some fat for absorption. And it requires patience. Give it 12 weeks minimum before you judge. The research is there, published in the New England Journal of Medicine, the Lancet, the Journal of the American College of Cardiology. These aren't fringe studies. This is the highest level of medical evidence we have. Your body has been waiting for this support. Your arteries have been dealing with decades of inflammation, and for the first time, you can give them something that actually helps at the molecular level, something that your cells recognize and know how to use. Start the conversation with your doctor. Show them this video if you want. Ask about your triglycerides, your CRP levels, and whether high-dose EPA might make sense for your situation. And if this was helpful, subscribe. I go through the research so you don't have to. Every video on this channel is built on published clinical science, not trends, not guesses. Science. Hit like so more people over 60 can find this. And tell me in the comments, are you already taking fish oil? And if so, do you know whether it's pure EPA or mixed? Because that one answer might change everything. Take care of yourself. Your arteries are listening. See you in the next one.